Forward. All right, so welcome to our presentation here on the airway adjuncts. We have some of our AT students here, Megan and Nicole, who are going to demonstrate how to do the OPA, MPA, and the King Airway. So we're going to start with the OPA. So as we talked about in the video, there's different sizes. Nicole is going to show up to show the different sizes of the OPAs. So we have very, very small OPAs to very, very tiny, and we have to measure those. So Nicole will demonstrate how to measure those. So we go from the tip of the ear to the tip of the mouth, and you see how she has the bevel down because that's going to how it's going to be inserted, or at the end after she inserts it, how it's going to look in the patient's mouth. So again, you recall in the lecture. The patient has to be unconscious with no gag reflex, no trauma to the oral pharynx or to the mouth to be able to use this airway adjunct. So Megan is going to show you how to insert. So you're going to be at the top of the patient's head. You're going to start with the bevel up. Go and show that again, Megan. So bevel's up. And then as she's inserting it, she inserts it to the back part of the mouth or the soft palate, and when she hits that soft palate, she's going to rotate it 360 degrees, and it then inserts into the patient's mouth. Then at this point, now this is now at the back of the throat, okay, or back of the oral pharynx, and then we can then use the bag valve mask. So now, as we talked about in the lecture, we do not have to do any head tilt chin lift with this particular airway adjunct. And as we talked, the BVM is best used with two people. So Megan has her hands sealed around the mask, and Nicole is then giving the breaths in. And then we can see here the lungs are inflating, but there is some going into what would be the stomach, because as we talked, this can require or does not completely cover the esophagus. Okay, all right, thank you for that one. So if we had to take it out, you want to pull down on the patient's jaw, and then as you are pulling that out, you just pull it out with the just pull it straight out of the mouth. Okay, and this can happen if a patient vomits as they're doing this, so we will have to do that if the patient gets to that point. All right, so we talked about the next airway adjunct was the MPA, the nasal pharyngeal airway. Now, one extra step with this one is that you do have to lubricate this, okay, before you insert it. So unlike the mouth, you have two options. You have the right nostril and the left nostril and the right nostril. You want to start with the right nostril because you want the bevel of the MPA to be facing the septum. And as you saw there with Nicole, she was able just to slip it straight in. And if you recall with this one, the patient can be conscious or unconscious, gag reflex or no gag reflex to be able to use this one. So we put that in there and then have them insert that. If you needed to go into the left nostril and not the right, you would have the bevel up, or the MPA would be facing up. So this one, you would have to actually twist it as you are inserting it. Okay, so that it goes down into the back part of the nasal pharynx. And just like with the OPA, we can then seal it with a bag valve mask and be able to then do the breaths for the patient. All right. And then the final one was the King Airway. So go and hold that one up there for us, Nicole. So again, that King Airway, if you recall in the lecture, has the two bladders, okay, that are currently deflated. All right. So, and we talked about the different sizing of the King Airways based on the color. All right. So this one, just like with the MPA, you do have to lubricate it, okay, before you insert it. And this one will go directly into the patient's mouth. It's already kind of curved already. So you just have to open the patient's mouth and then basically insert it in until you get to the back. And what you want to make sure you're doing is that you are leaving it out to where there's an opening right here, that you do not insert it past that opening into the patient's mouth. Then since it is inserted, we use the syringe to then inflate those bladders. So she will then push the air in, And with this, you can see here with this small bladder, we then are able to know that the other two bladders are inflated based on this small one being inflated as well. Now, the great thing about this one is now, we can hook the BVM. We take the pocket mask off of it and we insert that BVM on to it. And now we're going to get that air directly going into the lungs. So you can see the lungs are inflating and the stomach is not. Okay. So that is our demonstration here. And then to take it out of the King Airway, we got to make sure we take that air out before we then pull that King Airway out. All right. So that is our demonstration of the two airway adjuncts and the King Airway.